All right, welcome back to PT Meal Physical Therapy Podcast, a potluck of insights and information from Pinoy physical therapists for Pinoy physical therapists. I am Johan De La Paz, your host. Let's start the show. So for today's conversation, fresh from his webinar last week, well, at the time of the recording, the webinar is entitled DigiFlex, Digital Perspective and Alternatives for Flexible Learning in PT Education. From the Filipino Physio web series, let me welcome my guest, Assistant Professor Marvin Zotomayor. Sir Zots, welcome to the show.
Hi. Thank you for inviting me, Kuya Johan. It's a
Ah,
pleasure, finally, in this kind of a platform.
my pleasure.
Gusto ko to. Sige po.
My pleasure having you here, and thank you for lending your time. So, before I ask you, marami na tayo nakwentuhan kanina, pero before we move further to our conversation, I usually ask my guests kung paano sila nag-start sa physical therapy para baka may mga nakikinig na para makarelate sila do sa story mo. So, how you started in physical therapy and what led you to your current roles now?
Actually, Kuya, nung sinabi mo yun, parang sabi ko, mala MMK pala tong mala MMK pala tong journey ko. Anyway, it was really a tough journey for me, landing in physical therapy. It was never really my first choice. I was really, hindi ko talaga siya alam in the first place. It was like, when I just only took two exams for schools like UP and UST. And then for UST, first choice ko nursing, and then second choice ko was nakalagay sa USTET ha, USA examination test. And most of my students already know this na nakalagay doon sa second choice ko Bachelor of Tourism. Nakalagay siya, Tourism.
Okay.
And then nung kinuha ng ate ko yung yung paper, sabi niya, tourism ka? Ang liit mo. Ang liit mo. Okay. How about HRM? Ano ka ba? HRM ka na? HRM na nga ako, HRM ka din. Kinuha niya yung papel ko, tapos may sinulat siya. Tapos pag sulat niya, nung binigay niya sa akin, physical therapy. Ano to? Tapos, ayun, naging PT ako. And then, it was really, a roller coaster ride for me. I was never an intellectual student back in my college years, no. Hindi ako ganun katalino. And I really struggled being a PT student back then. And it was, and if you were to ask me kung after my graduation ng college, it would be something na very hindi ganun kaganda yung sasabihin ko. But through the years, it reflected to me na it with years, I mean, as you go along with your years, nagmamature ka, and then you get to realize that God has really a purpose. And it was really, for me, it was really just what I've been posting on Facebook na no more regrets, just lessons learned. So yun. And I'm also telling my students na life is not a race. Exactly. Just take your own pace. So yun. Yun yung summary ko.
Totoo yan.
Yeah. So, yun.
Kasi pag hindi naman kasi madali ang PT. Kahit ako naman meron din struggles before, and yun nga, na-extend ako sa PT journey ko.
Yeah. Appear.
Virtual appear. Ayun nga, and hindi ko inaasahan sa first time kong magkaroon ng failure sa educational life.
Exactly.
Go ahead, Kuya. And I mean, like what you said, it's as for me, hindi naman siya naging ganong kalaking difference compared to sa plan ko for myself in the future as a professional.
Yeah, totoo.
nakapagtrabaho pa rin naman ako.
Yeah.
Nakapunta naman ako dito sa US. So,
Yeah.
it was just a bump in the journey.
Exactly. And I just want to call out on those people or students who have failed in life, that life doesn't have to end if you fail. No, I just want to just want to give a shout out to all of those who have failed, that all of your failures would not be just merely be a hindrance to your life or success or eventual success in the long run, no. I think you have to God has really a purpose in your life. So you just have to take that leap of faith and have trust in Him. Because hindi naman niya tayo pababayaan in the long run.
Exactly. Though syempre, very valid naman talaga yung malungkot ka, you feel down, depressed probably. And it's okay. Feel that way for that moment. But know that it would get better.
Exactly.
And hindi siya death sentence, kumbaga. Na hindi na matatapos doon yung journey mo. Ay, susuko na ako kasi bumagsak ako. Hindi. Just go, push through. Pwede mo ma-correct yung mistakes mo in the long run. Tapos,
exactly.
If you become a physical therapist, when you become a physical therapist, then strive harder.
Right.
Exactly.
And guys, we are, Kuya Johan and I are living proof of, or products of failure, but
Hindi ko naman sabi mas success ako compared to you.
Ay, hindi naman. Grabe naman, Kuya. Hindi, at least, iba, where, we have realized and reflected on our own lives that we should, if you really love what you do and what you have learned, you would still go for it.
Exactly. And in the long run, since we are healthcare professionals, ang importante naman talaga dyan is your care for your patients.
Right.
Kasi even when you become physical therapist, hindi mo naman talaga alam lahat eh.
Exactly.
The most important thing is your passion for caring. And if there are things that you don't know, syempre, hindi mo na nga talaga alam lahat, you can still look it up. Madali naman balikan, di ba? So, yun lang talaga eh. Kailangan, nandun lang talaga ang puso mo sa pag-aalaga.
Tama.
Yan.
Ang lalim na agad. First question pa lang.
Ang heavy. Ang heavy na agad.
Kape muna tayo, Kuya.
Cheers. Humevi na agad, intro pa lang.
Humevi agad. MMK pala itong first question pa lang. Sige, Kuya. Hindi ako umiyak eh.
Actually, nung sinabi ko sa isang mga retreat ng mga estudyante ko before, parang nanginginig na yung boses ko.
Sharing, no?
Oo, yung sharing. Yung kaya may ano ka, pang-boost sa kanila.
To share, right.
Right, so, oo nga eh. Well, kasi marami nga naman yung mga estudyante na parang they think that they're parang lower than those regular students. Hindi naman, parang, well, don't think of yourself like that. Sige, nagkaroon ka ng pagkakamali, pero it doesn't really dictate or tell you how your future gonna be, di ba? So, parang...
Gusto ko yung sinabi mo, Kuya, no? I would just like also to point out that, just like what I talked about dun sa Digiflex, no? The society actually dictates how we think, how we should, how live, how we should... And I think we should have our own mindset and let's be more radical in thinking about ourselves rather than just going on with the flow. Diba? Because we all have our own minds. Diba? Kung makikiayon lang din tayo sa okay, dahil ang PT ay 5 years, ngayon 4 years na lang, kailangan 5 years graduate ako. That's really not like that, no? Even in after you have graduated, when you get to land with a job, it doesn't necessarily follow na you will be there for how many years? Minsan nga months lang, 'di ba? So it's really uncertain. So again, life is not a race, just take your own pace.
Tama. It doesn't matter how when you get there, but how you get there. And nandun pa rin yung goal mo eh. Di man mawawala yun eh.
Right.
So, okay. So, what are your affiliations right now sa kanila nag-work, sa mga connections mo?
So right now po, since academic vacation because of the pandemic na rin, no? Ngayon, I'm working as a chief physical therapist at JNRAL Physical Medicine Rehabilitation. So we have both PT and OT catering for catering our services for the community in Tanza, Cavite.
Oh.
So yun, heads up to my colleagues who are working in that clinic, no? And then also, syempre, pagdating ng August, I'll be back in track with my teaching affiliation, which is I'm also working in Manila Adventist College at Pamantasan, Lungsod, Manila.
Okay.
So I'm also actually advocating for both uh, hashtag treat and teach. So ganun yun talagang pinupush ko talaga na it's my passion to actually teach something that I do treat or something that I have also applied in my professional role as a physical therapist. So that I can, share something aside from what is being, discussed sa books. Because technically, our profession is hands-on. So we have to keep up with we have to keep a balance between evidence-based and something that is really, appropriate for our patients, which is technically eclectic.
Tama. Kasi we teach our students different techniques, pero different techniques would work in different people eh.
Exactly.
So hindi naman kailangan very dogmatic in one technique.
Yes.
And maganda yung sinabi mo that you advocate for treating and teaching. Kasi you're right. How can you teach something na you're not currently practice? Sabihin natin, diba? You're teaching this concept, pero sobrang tagal na nung experience mo. And how would you say na parang with all credibility and all confidence that it's still working now in the setting? So
And another point of view with that, Kuya, is with the advent of the new curricula for the physical therapy, na from 5 years ngayon, 4 years na. For those who are not familiar with the curricula of the ones that are venturing into PT right now, who came from the senior high, no, yung 4 years ngayon ng PT po is actually more of like specialization subjects.
Okay.
Kung sa atin po, previously, we have our TheraX, we have our MedSurg, we have kalat-kalat. Ngayon po, for the new curricula, for those who have graduated from senior high school, what we are catering for our new batch of physical therapists from the senior high, who came from senior high, are more on specialization subjects such as cardio PT, neuro PT, pediatric PT, ortho PT, and everything that is really, na-highlight doon kung ano yung mga subspecs. All kasama din po ang teaching and learning po doon, no, for educators. Kasama din po as a new subject for our new kids, new PTs who will be graduating. So it's really, it's really more specialized now more than ever.
So is it across all PT schools na ba or
Yes,
some
po.
PT school? Lahat na.
Yes po, it is a minimum requirement na for all schools to have such subjects to be implemented for their schools. However, may kalayaan na po kasi ngayon yung mga based on CHED, yung mga binigay na subjects for according to CHED, lahat po yun ay just merely recommendations and are just merely minimal requirements. So pwede po ang mga higher education institutions na magdagdag ng subjects depending on their local. So, or paano po yung trust ng kanilang graduate attributes. Let's say, for instance, yun yung sinasabi ko rin sa mga affiliated schools ko, no? Na if you were to actually create for something na, I mean, for the subject offerings for your school, make sure na align po yun sa ano ba yung graduate attributes sa gusto nyong um, i-hone sa mga graduates ng school. Kasi po, yun nga, as what I mentioned dun sa Digiflex, no, bawat schools are harnessing students to become PTs. Lahat naman ay PTs. But what makes you different from any other schools? And that is what I want to highlight. Kasi kung ikaw, PT ka rin, at karamihan lahat sa mga kasamahan mo sa internship ay PT din, what makes you what makes you different? Ano may offer mo na kakaiba sa iba? Kasi yun yung bentahe mo rin sa marketing for new students din na mag-apply for your program sa school mo. So let's say for instance, ang school nyo is ang thrust is more into CBR. Hindi yung graduate attributes nyo dapat nakalagay doon pang CBR. And then magdagdag kayo ng subjects na pang CBR. Kung ganon talaga ang thrust ng
college
graduate ng ultimo kahit yung college or university for that matter. So napaka-importante doon na alam ng department chair or even yung administrators ng college kung ano po ba ang institutional objectives ng kinabibilangan nilang eskwelahan. Doon po makikita kung ano ang dapat nilang i-develop sa mga PTs aside from being a PT, of course. Let's say, for instance, we are both, di ba, Tomasian, and one of the, nakalagay po doon talaga sa thrust ng pagiging Tomasian PT is someone who's not just a consumer of research, but also a producer of research, which is technically appropriate because as a university status, it is expected of you to produce research. Hence the reason kung bakit ang thrust ng UST PTs ay to produce more research. That is, hindi siya ginagamit, hindi siya reciprocated research. Something new, something, that would really change the norms or the scene of PT in our practice here in our country. So yun.
Pero as PT graduates, di ba, as graduates of Bachelor of Science, di ba lahat tayo were expected to produce research?
That's good. That's a good question, kuya, no? There are actually, depende rin kasi yan sa local ng school nyo. Is it more of like college ba kayo? Is it an institution? Is it a university? So nagkakadepende yan sa kung anong heading ka. Kasi kung makikita mo din sa CHED memo, may appropriate na po yun, trust for research.
Okay.
Kunyari, pag university level, kayo yung magpo-produce ng new trends. Kasi you have the means for it. Yeah, for college or institution, pwede minimum requirements sa inyo makapag-produce, but hindi ibig sabihin nun na kailangan talaga makakapagpabago ng hindi naman kailangan 'yon. Hindi naman kailangan 'yon. For example, pag college or institution level, pwede kahit mga within your locality lang siya na magagamit. For example, kunyari may eskwelahan ako dito sa Maynila, pwede kong ang mga trust ng mga ng mga researches namin ay para sa ikabubuti ng Manilenyos. Pwede po 'yun. Mga ganun po 'yun. Pero pag university level ka talaga at ang level mo ay CHED level, ano ba 'yun, kuya? Yung mga level 1, level 2, level 3. Ang USC level 4, PASCO level. Expected talaga na mataas talaga yung dapat mga produce na research. Because there's a third party who had vouch for your credentials.
I see. That's on per college level college na thrust. If this is your thrust, ito yung i-align for your curriculum.
Yes.
Okay.
Yes.
Pero you were as we're talking about the new curricula, may changes din ba sa, di ba, we're talking about alignment, your curricula to a board exam.
Oh, that's nice. What about it?
Anyway, kasi since we already changed the curricula, we focus on specializations.
Cool.
Would there be also changes? Mag-trickle down ba yun sa how they take the board exams, or is it still the same?
Disclaimer lang po, Kuya, or for those viewers listening, no, I'm not in any way representing the and for the technical committee for eduk's eduk tama ba? Small interest group ba?
Special interest group.
Special interest small special interest group, no.
Mm-hmm.
This is my way for us to have, awareness with regards to what can be I mean, just give some insights, no?
Mm-hmm.
Because maganda nga talaga yung gantong platform ni Kuya Johan, no? For us to really, parang let's get to have a conversation, talk about it.
Mm-hmm.
And let's see how viewers or our listeners would take on it, no?
Mm-hmm.
At yung with regards to the board exams, tama yun, no? I think our EduSig has brought that up with our PRC, no? As to alignment.
Mm-hmm.
Hindi lang kasi siya dahil, because of the OBE curricula.
Mm-hmm.
O, hindi lang dyan natatapos yun.
Mm-hmm.
Yes, OBE curricula tayo ngayon, which is outcomes-based, or with the, kung ano yung ibig sabihin ng OBE, no? Outcomes-based education na curricula. At hindi pa dyan natatapos. May flexible learning din tayo. So, dalawang pagbabago ang ginawa mo. sa taong to pa lang.
Oo.
So, diba? PRC, anong gagawin natin?
Pero for this year, di ba pinospone nila yung board exam? So, are they gonna, itutuloy ba nila on next year, February, yung board exam?
Based from wala pa kasing recent announcements. May announcement lang na there has been a cancellation already for this year.
Mm-hmm.
But for the kung kailan daw siya manilipat, I think it would be most probably like on a February din.
Mm-hmm.
However, mag-a-apply pa rin kasi yung mga nakagawian na.
Mm-hmm.
Pero yung mga galing na outcomes based, yung mga galing senior high, doon na magbabago.
Okay, so hihintay muna nila yan.
Dapat magbago yung atake sa board exams. Kapag yun dun sa mga sa mga third year ngayon, na galing senior high school. So give it 2 years, 3 years. Dapat meron ng naluluto na pagbabago as to the blueprint ng mga questions, no? So yun.
Okay. So very passionate ka sa sa education. Is it where did you find that passion in education?
Wow.
Is it from your PhD or before pa?
Wow. Na siya? Ang lalim. Wait lang. Kape muna tayo, Kuya. Actually, Kuya, when I was still a child, mahilig ako manggaya ng mga teacher ko. Di ba, uso pa yung karto-kartolina.
Manila
diba? Manila paper. Ewan ko, parang timang ako ng bata eh. Kasi gagawa talaga ako ng sarili kong Kunyari ako yung teacher, tapos ipapaste ko pa dun sa ding-ding. Tapos tuturuan ko yung sarili ko. Okay. Tapos gumagawa din ako ng lesson plan. Hindi ko na mag-gets bakit ko ginawa yun ng bata ko. Gumagawa ko yung sarili kong lesson plan. Tapos, sabi ko, nung high school din ako, parang gusto kong magturo. Pagdating ng 4th year, nandun yung kasagsagan ng nursing. So, sabi, patol naman sila, gusto din nila nursing. Tapos, yun, hanggang sa naging college, nakaka-admire yung mga professors kasi din natin, Kuya, na, alam mo yun, they're very well-versed, everything you can think of. Any superlatives or adjectives that you can think of. Nakaka-inspire sila. Emanating that professionalism. Doon ko parang, Wow. Ultimo, first slide pala, nandun na yung mga apelido nila. Ang haba ng pangalan. Tapos, yung introduce pala nila yung pangalan nila, nakaparagraph. Kung saan sila affiliated. Ano ba, degrees. So, wow. Alam mo, sa ante sa time na habang nagka-classic kami, ako rin gagawa din ako ng sarili kong pangalan. Lagi yung pangalan, Marvin Zotomayor, MSPT. So, gaya-gaya lang talaga ako noon. Gaya-gaya lang talaga ako noon. Tapos, ayun. Tapos, nung nag-review for board exams, hey, gold rank. Nagturo din ako sa gold rank. Yun po. Doon ko na-realize ang galing, parang gusto ko rin yung ganun na makatulong din sa mga estudyante.
Mm-mm.
Iba yung naging motivation ko when I was, nung nag-aaral for board exams. And after board exams, sabi ko sa sarili ko, I want to help those who are really struggling as to learning. Gusto ko magkaroon ng connect ang mga nasa laylayan. Yung mga hirap na hirap, makaintindi. Also to those who are the raw for people. Hello. Raw for din po ako.
Ako yun eh.
Di ba? Mga
sa likod.
Oo. Lalo na kapag alphabetical, kawawa na naman.
Oo.
Siyempre, raw for talaga.
Automatic ka na nun.
So, isipin mo, parang kinakausap nila yung mga nasa harap. Tapos kami, sali naman kami dyan. So, tapos, and then I get to realize na gusto ko yung role ko as a professor is not really in the front, but someone at the back. Because I want to make those who are really having a hard time, keep up with what's going on in the class. And also, I want them to have an active style of learning rather than a spoon-feeding type of learning. Kasi kung nakasanayan nila, dito talaga culture shock talaga mga estudyante ko sa akin. Kasi nakakasanayan nila yung mga sa mga ibang professors sila na spoon feeding, ito yung babasahin mo, aralin mo. Ako nang bahala, ganun. Pag sa akin talaga mapapabasa ka talaga. Kasi may pa-citation pa ako sa tanong kung saan ko kinuha yung question ko. Para at least fair. Para at least fair. Para malaman din nila kung saan ko pinagkuhanan yung tanong. So, ibig sabihin, pag alam nila na ganun pala yung teacher ko, magbabasa pala talaga ako. Kaya, yun yung gusto ko rin na at the same time, for my students to really appreciate reading because I wasn't really a reader when I was a student. So I want them to make the most out of those pesos that they bought from bookstores. Make the most out of their books and read. Kasi sa atin lang talaga sila matututo magbasa.
Tama.
After us, it will be just, it will just come out spontaneously and naturally.
Kasi nowadays, students are only reading, we call this, PowerPoint slides.
E-book. Yeah, and slides, right? Totoo yun, no? And there's no harm done for those. They have such learning styles that I'm not against of, but iba pa rin kapag naiintindihan mo talaga yung binabasa mo. And I want to also tell to all educators out here that pag binigay niyo po yung PowerPoint niyo or nagbigay kayo ng reading materials, make sure po na something that you would also explain after. Kasi mahirap po yung binigay mo lang yung chapter, explainize mo lang or clean-up mo lang yung pages and then bahala na yung mga estudyante. Mahirap po yun. Lalo na for them who don't or just starting. And that's the reason behind bakit ako nagturo. To have that connection between students and the teacher itself. Me not acting as a teacher but more of a facilitator.
Right.
So yun, magkaroon ng ma-facilitate ko yung learning ng students ko depende sa kung paano sila matuto. At the same time, engaging for them para hindi lang lagi sila umaasa lagi parate sa teacher or sa kaklase nila.
Right. Hey, you mentioned paano sila matuto. So, di ba, students would have different learning styles. How would you determine, in your experience, how would you determine specific learning styles ng mga estudyante mo to adapt how your teaching style would be?
Yeah, I think ma-appropriate kasi na dapat sa bawat learning opportunity mo or dun sa yung i-present mo sa students mo, dapat makuha mo yung learning styles. So, meron kang pang visual, meron kang pang kinesthetic, meron kang... So, lahat sa pagtuturo mo, ma-encompass mo lahat ng learners. Tapos, doon mo makita, dito siya nag-shine.
So, try mo lahat.
Try mo talaga siya lahat.
Hindi ka lang mag-stick sa isa.
Yep. You have to be multimodal. Kasi you have to be multimodal in response to various learning styles of your students.
Okay.
Sabi nga nila, kasi kuya, I would just like to add upon it, kasi sabi nga, nagbabago yung scene rin ng education. Lalo na ngayon na, based from what I taught during the DigiFlex, you have to keep your students engaged and give them variations, because variability is very important. Kung baga sa joke, hindi pwedeng magjo-joke ka lang ng paulit-ulit.
Ulit-ulit. Still.
Kasi pag paulit-ulit mo, ginoke yun, hindi na matatawa yung audience mo. Same thing with education or yung style mo sa pagde-deliver. Hindi pwedeng paulit-ulit.
Corny na. Pag inulit mo pa.
Yep. So yun. Dapat meron ka element of surprise. Pero dapat nasa syllabus yun. Oops, surprise. Hindi pwede po yun.
Magulat na lang kayo. Ayan. Well, tapos you mentioned earlier as well na you have them read. Di ba, na-mention mo din yun sa, di ba, sa Digiflex na that would be like if you ask them to read in advance, then they can discuss it inside the classroom. It's like the flip model.
Yes,
so minsan may yung
learning, right?
So you also make use of that.
Of course. I've been using that strategy since today's 2020. This year is 2020. So I started that since 2017. Yeah, something like that, And I've been advocating, flipping the classroom. Kasi mahirap yung sa oras mo na sobrang limited lang, doon pa kayo i-lecture mo, i-demonstrate mo, ang dami mong pinagawa. Where in fact, you can actually give them out kung ano yung papabasa mo na importante. And then during the discussion, during your time, protected time, or your scheduled time nyo, doon yung pag-usapan kung saan kayo nahihirapan or saan sila nahihirapan. I-discuss nyo kung ano yung output na pinagawa mo last week. So that would be your guide during the discussion. If in the event that students are still having a hard time with regards to answering yung content na binigay mo sa kanila a week ago. And also, that's a good way for you to check on formative assessment. In a way na, ginawa nila to. This is my check for me to know that my students have really, worked their work their way to accomplish the output. Otherwise, mararamdaman mo yun during discussion na, so sino gumawa nito? Bakit parang hindi nyo alam yung isasagot nyo? So yun.
Right. Pero ang naisip ko sa kasi ganyan, parang baka may barriers din ng students in terms of flip learning. Kasi like hindi natin alam yung mga struggles sila sa bahay.
Right.
So,
That's
paano
good.
kung meron silang mga family responsibilities,
That's good.
tapos mag-a-add pa yung flipped learning, kailangan nila mag-aral with different courses or subjects. I mean, would that be like, ang flipped learning ba kailangan like lahat ng lessons or just certain lessons
Ooh,
or
okay. That's a
certain
good point, no?
subjects
That's a
or
good
all
point.
subjects?
That's a good point, no?
Mm-hmm.
Sige, magandang tanong niya ni Kuya Johan.
So kasi, di
Actually,
ba,
ang
in ideal
yeah.
world, pag sinabi natin, maganda yung flipped learning.
Mm.
Kasi, students are prepared already coming to the school or they already have their questions in mind. So, yun nga.
Actually, Kuya, ang flipped learning, you can do, may ano yan, sa joke din, may timing. Ganon din sa pagbibigay ng flipped learning.
Mm-hmm.
Hindi ka pwede magbigay ng flipped learning na totally hindi nila alam. Yun. Maganda ang flipped learning kapag meron silang background knowledge about it.
Okay.
For example, ang flipped learning, appropriate siya for subjects that are clinically relevant. For clinical subjects. Because they have previous knowledge based from their basic subjects such as anatomy, kinesiology, name it,
They should have.
they should know it. So if in the event that they have struggles of their basic subjects, doon mo makikita saan sila nahihirapan. Kasi doon sa guide questions, specific yun. Hindi po pwede nagbato ka ng mga random questions. Dapat yung mga guide questions mo are like stories. Kung yung sa joke din may kwento. Sa guide questions din may kwento. Dapat from yung umpisang question mo should be something that is basic, kasi anatomy. Then nagpo-progress yung question niya which is related to a case or whatever you may want. No, parang nakikita mo yung aspeto na gusto mo makita. Bilang clinical educator ako, most of my subjects are for clinical integration subjects. I'm teaching clinical education, seminar, TheraX, and those are the subjects that really, are integrative in sense. Kasi ako yung, hinelm ko din kasi sa Adventist yung clinical integration subjects. Paano yun? Ang ginawa ko is, for every week, isang region kami na magkakapare-parehas kami na tinuturo. Paano magkakaiba? For example, kung kunyari, yung araw, tama. Si TheraX, ang focus ay exercises. Si seminar, documentation skills, and clinical reasoning. Si ClinEd, dyan na papasok yung pang-clinical aspect. So, doon mo makikita yung differences where in fact, kaya mo siyang i-discuss na in one day. And since for the purpose of the curricula, it has to be different. Diba? So, ang ginawa ko, hinelm ko siya in a manner that would, tugma siya. Para ang estudyante, ang aral, isang basahan lang sa isang linggo. Let's say, for instance, ang topic for this week ay hip. Si TheraX magdi-discuss ng exercises for the hip region. Si seminar magdi-discuss ng for example, one ortho, one surgical na case for documentation related to the hip region. And then for the third, sa ClinEd, magdi-discuss ng assessment, ng SOAP for, tapos may performance pa for the hip region. So, in a way, si estudyante parang nasa joyride.
Tama.
Na meron siyang iniisip na, wow, okay, nako-cover ko lahat ng hip in just 1 week. And that makes it more integrative, more mas madaling aralin para sa mga estudyante at hindi sabog ang utak.
Totoo na hindi halo-halo.
Hindi halo-halo. So yun yung in-advocate ko when I started nung 2000. Sorry, when I simula ako magturo 2016. Then I make changes noong 2017.
Mhm.
So yun. Doon nun
Mm.
nagmamaterialize na siya ngayon na mas okay talaga ang integrative and that goes well if you have synergy with your faculty members.
Yeah, I would have to agree. Kasi we tried that when I was part-time teaching in UST as well. Na aligned na yung mga yung syllabus ng Clean Ed,
That's
ng
good.
PTSM, tsaka Thera. Ideally, ang ganda na naka-align na.
I know.
Yeah, there are times na syempre,
Hindi talaga maiiwasan.
Hindi maiiwasan na there are times na napapa-extend yung lectures kasi there are hindi naman dahil sa estudyante, but there are a lot of questions within that topic na
Sure.
kailangan mag-extend ng
Totoo.
ibang days. So, minsan nagiging out of sync na kahit kahit sa planning na i-plan na this week, ito lang yung reason. Pero yeah, there are still some unforeseen circumstances na hindi talaga may iwasan. Pero for the most part, sa umpisa, makikita nga talaga yung alignment. Even for the practical exam, before, di ba, ayaw ko lang kung time nyo. Yung time kasi namin sa mga practical exams, talagang separate na eh. Separate pa. Pero nung nagturo na ako, as in, magkakasama na sila sa pracs. So,
at
parang
nagulat
isang
na din ako, sa USC din, di ba kuya? Meron ng pracs din sa seminar. Meron. Sabi ko, wow. Actually, na-visualize ko na rin. Nagkaroon din rin ako ng foresight na magpa-prac sa seminar. Wala lang. It's a good take. That's a good take. Because I think that's really something that, educators would actually look into. Patient history. Asking patients or asking, kung assessment, treatment-wise, nahihirapan na sila, paano pa kaya sa pagtatanong?
Oo.
So, that is something.
Minsan yung ibang mga estudyante nahihiya kung tanong. Tapos minsan, nahihirapan din pumili kung ano talaga yung mga, isa atin is top 5, pero everything is essential naman eh. Para yun. Nice. So, we're in this situation na COVID-19, and you mentioned sa webinar mo that yung meron kang stages, exigency, sinulat ko talaga yan. Exigency, transitory, tsaka new normal. So ano na ang ma-expect natin sa new normal? Like, di ba, like our profession is skill-based.
Yeah.
And how are we gonna, well, again, in your personal take, how are we gonna attack this now na ganito ang situation natin na hindi pa natin alam kung ano na mangyayari within the few months and probably year, I don't know.
Actually, that's another good question, kuya. Kasi with there's this school, hindi sa PT school sige na, sabi ko na nga. Sa Lasal kasi, sa Lasal, sa website nila, meron silang frequently asked questions. And then, dun sa one of the questions there was, bakit tuloy pa rin yung klase? Pandemic. Ang sagot ng Lasal, sorry, I'm not, hindi talaga to yung verbatim, pero ang parang, ito yung parang pagkakaalala ko na, this pandemic might be, we might be expecting this for 3 more years. So learning cannot be stopped.
Okay.
Same thing with us, no? Aminin naman natin sa lahat, we live in a business society. No? Mawawalan din ng antag mo doon. Mawawalan din ng mga PTs. Magkakaroon din ng kakulangan sa healthcare setting kapag walang bagong lisensyado.
Graduate,
walang graduate, 'di ba? Hence the reason why we should not also stop because of a disruption in education. Actually, this is a good avenue for us to actually check on how are we keeping up with regards to disruption in education.
Mhm.
What I'm trying to say here is, kapag, kunyari, nagkaroon ng calamity, other
Mhm.
than pandemic, ano ang pwedeng remedyo para
Mhm.
hindi nagkakaroon ng make-up classes?
Tama.
'Di ba? Kasi di lang naman ito ang pandemic na pwede mangyari in the long run. Hopefully,
Mhm.
sana hindi ito na lang talaga, no?
Mhm.
Ma-experience natin. But, let's say, for instance, calamities, unforeseen circumstances, socio-political issues that would disrupt education, rally, and all. Do you see your schools keeping up with suspension of classes?
Mhm.
Di ba? When the provinces are actually keeping up with their schedules
Mhm.
sa Manila, example lang po ha, for example sa Manila sila doon yung dahil maraming disruption, dahil sa maraming welga and everything, no, so maraming baha and all, so maraming suspension ng classes, pwede ang daming kailangan i-catch up ng mga schools,
Mhm.
hindi naman
Dami.
pwedeng i-extend ng lahat.
Oo.
Kasi pag in-extend mo yung eskwelahan mo, mag-extend dapat lahat. Hindi naman apektado lahat.
Mhm.
And that is something, that's a good point. If the VUCA, the agile VUCA, if you were going to talk about that, no, that's the agile VUCA. If you would want to, you have to think of solutions
Mhm.
rather than just, be rigid and let's just wait for it to end. Mahirap yung ganun. Kasi we have to be, let's all keep up with whatever it is that happening so that we can think of solutions
Mhm.
so that para marami ding hindi matitigil, no?
Mhm.
Nag-gets ko po yung punto. I'm also with you guys for those students or families or parents who are also listening or watching this recording, that it's really hard to go about this kind of pandemic having education at
Mhm.
the same time. But, if you could, have an open mind.
Mhm.
Kasi kapag kunyari naging na rin to, nag-normalize na rin tayo, hindi ba magandang oportunidad na yung mga ibang subject na kayang ituro naman through pre-recorded lectures, ang anak nyo po o ang mismong estudyante nasa bahay lang nag-aaral? Tapos kapag mga mahihirap na subject, doon sila papasok. So ibig sabihin, nabibigyan po ng day off ang mga bata. Di ba? Nakakaroon sila ng family time kahit nasa bahay na rin sila. Nakakapag-aral sila kahit nasa bahay lang sila. Di ba? Hindi ba magandang oportunidad yun para sa ating lahat, no? Na we can find our own day off
Mhm.
kahit nasa lang tayo, confines of our own home, di ba?
Ah.
That's another that's a good that's a bright side of having this, di ba? Ngayon lang to na-discover ng karamihan where in fact dati na tong practice,
Mhm.
no? Even sa States, you have your transitional DPT who is online, di
Mhm.
ba? Kaya naman. So, may sabihin, no, we have to keep up with the trend. I'm not really saying na let's just go with the flow, but the society is actually, shifting, no, how we should live right now. And we are in the digital economy.
Mhm. So you're
So,
thinking
yeah.
that whatever we produce in terms of PT education in this pandemic would trickle down as something permanent,
Something permanent, hopefully, it's not,
like
okay,
blended, not full.
yes.
Uh-huh.
Yeah, I'm an advocate of a blended type of learning,
Mhm.
no? Or more of a hybrid
Mhm.
learning, no? Kasi syempre, mahirap naman po sa ating profesyon na hindi tayo mag-face-to-face.
Na totoo.
Kailangan po natin matutukan yung mga estudyante natin, lalong-lalo na sa patient care.
Mhm.
Mahirap po kasi mag-assess na, video, tapos yung kamag-anak lang nila, someone they live with, sila yung magiging pasyente, they don't even know what do we do. Right?
Tama.
Neither do students know what they're doing. Right? So, again, no, that's something that we should also look forward to. No, na it's good to have a blended learning, not really a fully online. Kung gusto nyo po mag-fully online, go for courses or certifications that can be offered online. But as a profession, hindi in my own personal view, hindi po appropriate magkaroon ng fully online na physical therapy course.
Of course,
Lalo
kasi
na
syempre,
bachelor's degree.
Kasi nga, we are skill-based. Tsaka,
Yes.
how would you teach interaction, rapport in an online platform? Pero
Actually,
going
kuya,
to... sige.
Gusto ko yung sinabi mo, kuya, na how can we go about with rapport, interaction in an online platform? Actually, kuya, I have also recommended yung sa ipapalabas na draft ng ano tawag doon, ng technical committee ng ating PT. I have suggested with regards to having a virtual resource hub sa mga schools, no, or even clinics, no, na mag-put up sila ng isang website na nandoon nakalagay lahat ng kanilang mga videos or whatever bala do they have, no, kung saan ultimo yung line of questioning interviews. Sasabihin ni patient, okay, ito from a real patient, tapos naka-blind lang yung no? Siyempre dapat kasama ang consent sa pag-treat, no? Pag hindi pumayag, karapatan nila yun. Walang problema doon, okay? Pero kung sa umpisa pa lang sinabihan mo na agad ng mga pasyente ninyo that this is for educational purposes and that your personal identifiers will be scraped off for your privacy and confidentiality, if that has been established, better. Since we are educators, no, kaya nga gusto ko nga talaga ng treat and teach para lahat ng mga natitreat ko, pwede ko maituro. Kasi yun yung mga bala ko rin kapag nagtuturo ako. Yung mga personal interactions ko with my patients, no? Kung lalagay natin lahat yun sa isang sa isang website, for example, for first year, ito mga videos nyo for the subject and all of let's say for instance TheraX, may subject for TheraX, second year, let's say for instance ganun. Okay, ito yung mga videos, tapos dapat naka-curate siya na parang learning playlist. Ganda yun, yung parang para ka nag-Spotify or para ka nag-Netflix na I've learned this through many webinars na nakakatuwa na may ganun talaga. Learning kung dati nauso, kung ngayon pa lang na-experience or nagkakaroon ng kaliwanagan or ngayon pa lang nagkakaroon ng awareness ang sangkatauhan with regards to learning management system, ay matagal na po iyon. Ang bago na po ngayon is learning experience design. Okay? Also known as your LXD. Okay? Hindi na po learning management system. Learning management system ay yung mga Blackboard, mga Moodle, mga Google Classroom, Microsoft Teams. Yun po, puput up nyo lang po lahat ng mga resources nyo, okay na yun. But with the learning experience design, bibigyan nyo sila yung mga bata ng kapangyarihan, the voice, and their choice to learn kung paano nila gusto matuto. At their own pace, at their own time. Wherein, nandoon yung may hyperlinks na, okay, you want to study this? Okay, click on this. And then, i-route ka niya sa archive for that topic. So, i-review niya yun. And then, parang may kapangyarihan siya to learn whatever he or she likes. Di ba? So, yung maganda. And that's the same thing with learning, with what I'm trying to say with regards to virtual resource hub, na ilalagay mo doon, for example, may pasyente doon, sinabi niya, actually, nahirapan ako itaas yung kamay ko na gano'n. Nandun na. Yun na yung clip na yun. Okay, let's discuss. What are your top 3 diagnoses? Diba? doon may interaction. Nandun na yung pag-iisip ng bata. That's more, if ano pang pwede doon? Kung gusto mo, seminar. What are some pertinent questions that you would still want to ask based on that clip?
Mm-hmm.
Di ba? Binibigyan mo siya ng
So, nandun na lahat ng buong lecture mo.
Yes. And then another strategy for that would be your layered cake design. Paano yung layered cake design, no? Una-muna, bibigay mo snippet ng S. Okay. Binigay mo yung snippet ng S. For example, sinabi lang niya, chief complaint, goal, patient's goal, and everything. Tapos, HPI, konti lang. Tapos, bahala na yung groups through breakout session, pag-usapan, kung ano pa mga pertinent questions na pwede lang itanong. And then, you go back as a class sa isang session kung saan pag-usapan nyo na, okay, what have you noticed based on the clip that I have provided? Ano mga pertinent questions that you would still want to ask? And then, doon na kayo maghihimay-himay. And then, another breakout session na, okay, ito dapat yung mga appropriate na, ito yung totoong S ng patient. And then, next step, provide O. Kayo yung magpo-provide ng O. And then, papakita nyo yung clips na ito yung gate assessment ng, for example. So, ibig sabihin, merong journey. Nai-engganyo mo, nai-engage mo din yung mga estudyante na, wow, hindi lang siya monotonous.
Tama. Nung sinasabi mo yung like videos with a patient, ganyan, meron kasi kaming, merong website dito na for our CEUs na you pick the topics that you wanna do, tapos meron sila doon parang assessment and history taking and assessment. Tapos meron nga sila doon live. Siyempre nasa studio, nandun yung may treatment table, nandun yung patient, nandun yung therapist. Tapos at least I think the whole duration ng history taking and assessment pinapakita nila doon. I mean,
that's good.
Gate trained, posture, then gate deviations. Ay ko, okay. Maganda rin pala siya. Pwede rin pala siyang gawin as a classroom.
Kuya, pre-recorded lectures yan?
Kasi kasi siya eh. CEU provider talaga siya. Tapos,
that's good.
Lahat ng mga lectures nila may component na ng continuing education. Tapos, as a professional, pili ka lang kung ano yung applicable sa gusto mong tapusin. Tapos, at the end of the course, print out ng ng certificate. Then, syempre, pag may account ka sa kanila, nandun na lahat ng mga courses that you finished. So, if ever magtanong man yung regulating body na ito yung certificate mo, totoo ba to? Look at my account. Ito na yung nandun na lahat. So, I mean, yun, pwede rin pala, tama, you reminded me of that you can still teach rapport, history taking, in a video platform.
Actually, Kuya, no, I would just like to add up on that, no. I think it's about time for us now. Wag natin ikahon. Ito yung pagkakataon to. Very good time for us to really, exhaust our creative juices and to work in unison with one another, to cooperate with one another in thinking of ways rather than just, ay, hindi maging effective yan. Ay, hindi mag-workout yan. Ay, dead-end na tayo. Hintayin natin ang sasabihin ng administrators natin. I think we should have our own initiatives. Kasi ang importante dito, guys, sa lahat ng mga nakikinig, ang importante dito ay ang kapakanan ng mga estudyante natin. And let's be more proactive in delivering the right education for our own learners. More than everything or anything.
That's right. Kasi maganda ngayon na at this time makapag-adapt na yung educational or delivery ng education ng physical therapy. But going to like the concerns, probably struggle ng students if we're gonna have them do more and more of an online presence. Diba, you mentioned kanina na what if, diba, pag students would have their family time, they would say na, paano magiging family time? I am studying, I'm in front of the computer. So, it's still added work. Parang work from home, na sinasabi nila it's a vacation, pero mahirap mag-concentrate sa bahay.
Right.
marami kang, kumari, may anak ka or hindi naman sa estudyante kasi. So, meron kang chores, sabihin sa'yo
Yeah.
ng mom mo, computer ka ng computer. Nag-aaral ako.
Ngayon,
Or,
baliktad na ngayon, no?
di ba?
Okay na
Or,
ngayon pala bumabad sa computer at saka cellphone ngayon, no?
totoo.
Accepted na.
Tapos, then there's the added burden of
Yes.
kuryente,
Right.
of kailangan maganda yung internet connection mo, as opposed to if you send your kid to school,
Right.
ang ano man ay pamasahe. So kung
Right.
nagdo-dorm siya, nandun lang siya. So siguro yun yung mga concerns din if
Right.
on adapting an online presence sa education. I mean in general siguro.
Right.
And also for the side siguro ng mga educational institution, syempre this is new. So we're going to integrate subjects, kailangan maplano na natin. Kailangan brainstorm what are the things that we need. Kailangan maplano na yung mga content. Maplano
Totoo,
natin
kuya.
to, di ba? So I think pero this would be a good time to adopt that, pero mahirap mag-adapt din ng kabilis.
Right.
Oo,
It
so
really, hindi siya pwedeng, hindi siya pwedeng 24-hour within the day na, okay, napag-isipan ko, sige, ganito yung gawin nating strategy. No.
Okay.
Totally no. Lalo pa, no, ito pa, good point, good. It's good that you mentioned that, kuya, no? Because, ang laging thrust ngayon ng webinar for schools that I've been hearing and been talking, having conversations with a lot of educators elsewhere, ng focus or yung thrust ng webinars nila is to have their online presence. Like, for example, have a backdrop, na green screen. No? Paano yung mga, ano ba yun? Si Lola, yung nagdodota ba yun? Mobile Legend? Tapos, di ba, nakikita mo nakikita mo ba yun, kuya? Yung may viewing, tapos si nanay naglalaro, na nakaupo lang siya, pero may green screen siya, tapos makikita mo yung nilalaro ng nanay. Sabi ko, ganun daw ang gusto na magiging trend ngayon na for digital education. Sabi ko, nagigets ko yun. Digital education, we have to be like, keep up with the digital tools and everything to keep our online presence. But, ang importante po doon is alam ba ng mga educators on how to implement curated syllabus. Napaka-importante po na dapat alam nila ang pasikot-sikot ng paggawa ng syllabus. Kasi mahirap po na magiging drastic din ang change na gagawa ng papa-activity out of nowhere. Naisip ko lang, bored ang mga estudyante ko eh. Sige, pagawa tayo ng activity, ganito. Lugi ang estudyante. Nauubos din ang oras nila sa mga spontaneous activities. Yes, you want to engage your students. Yes, you want them to be alive and everything, no? But then again, no, if it's not in your syllabus, how can they be... Oh, gets ko. Pinagawa mo, nagpa-activity ka. Paano sa summative eval? Diba? Nagpa-game ka and all. Pero pagdating mo na sa summative eval, ang ginamit mong exam ay hindi dun sa tinuro mo. Para, diba? Napaka-importante po talaga na amidst everything, every webinars that you are attending currently, no, about the use of appropriate mic, anong appropriate na, yung pang, ba, may nagbebenta pa nga ng pang mic na ng pang mic na parang nasa recording studio, no, para maganda ang online presence mo and everything. May headset ka pa, yung pang pang gaming console. Sabi ko,
sorry naman.
Ay, sorry.
Hindi naman kasi over podcast naman yun.
Yeah. So yun. Kaya pala tatawa ako. Anyway.
Sorry naman.
So yun, kuya, no? May mga ganon. Even, ano pa ba? Touchpad, no? Para doon ka circle sa PowerPoint mo, makikita nila, no?
Mm.
Ang daming media tools. Pero kung empowered ba or alam ba ng educator yung gumawa ng syllabus? Kasi what I have mentioned at the end of my webinar was better teaching is about methodology, not technology. Kahit ano pang technology ang gamitin mo, kahit ano pa ang gamitin mo, kung alam mo paano magturo, it's not necessarily mean na marunong ka magturo, okay na yon. Pero yung kaalaman mo as to alignment, napaka-importante kasi yun eh. You'll never go wrong if you know how to go about with instructional design or syllabus. No? Parang katulad din yung sinabi ko doon sa last slide na educators are drivers, students are passengers, and then the bus is your learning delivery option. But students can travel at any mode of transportation. For as long as tayo din ang driver, di ba? Kahit ano pang learning delivery option ang gawin natin, miski face-to-face, miski miski distance learning, online learning, kung ano-ano man pa, pero tayo pa rin yung driver ng mga estudyante. Ang common goal talaga dapat natin is for their learning. No? So hindi lang siya basta-basta direct translation from direct translation dahil nag face-to-face learning ko, ito gagamitin ko yung syllabus, magmamat na mag-workout to pag ginamitan ko lang to ng digital equipment. Okay, explain. Okay, nagpa-podcast ako. Okay, nagpa-IG story ako. Explain na yun. But then again, magta-translate ba ang pag-explain niya? Gumamit na siya ng cellphone. Diyan na papasok yung Samir model. No? Ang dami ko, di ba? Alignment is everything. No? Kaya kung napanood niyo po talaga, no, I hope you guys would take time to really watch yung webinar ko. And you would really, if you would connect everything, it has, para may kwento talaga siya from start to finish. Magkakadugtong po yun. Kahit pag ikut-ikutin mo pa yun, related sila sa isa't isa. So, ganun din po dapat sa pagtuturo. Kahit ano pang technology ang dumating, for as long as the teacher or the facilitator knows how to make use of technology, despite, kahit ano pa yan, marunong siya with the methods, he or she will not go wrong.
Tama. If you haven't seen the webinar, panoorin nyo. Talagang marami kang matutunan. Sobra. Marami ko na mga points na tinik down. Pero I mean, going back to din sinabi mo na, like, as long as they know how to make use of technology. Kasi di ba, the content is already there, nasa utak na, nasa syllabus na ng educator eh. Pero we parang most of the schools and educators weren't prepared. Hindi naman nila wala man nakapag-foresee nitong situation na to eh. So siguro we would have to give them time to adapt.
Sure.
Para curate the content, the information, para hindi redundant if ever ilalagay sa di ba? Ilalagay sa what do you call this? The LXD, learning experience.
Learning experience design. Sige, go.
Para hindi overlapping, hindi redundant. So, parang natural content creators na mga everywhere, like mga influencers, that yung content na yun ay siksik na, nandun na lahat ng mga kailangan ng estudyante, ng ayoko sabihin bata, di ba? Hindi na sila estudyante, para hindi na sila magkiklik pa na isa or ganyan, para yung concern na internet connectivity at time na-address na rin natin. So siguro, mahabang planuhan siguro talaga doon na kailangan pag-upuan ng mga educators to
bigyan
adapt.
Kita na example, kuya, no? Bigyan kita ng example, kuya. I was offered to teach for organization and administration. Sabi ko, oh my God, ba't ako magtuturo ng ORAD?
Ah.
Kasi daw, educational leadership and management daw yung ano ko.
Yung PhD
Yung
mo.
PhD ko.
Ah.
Sige. Patol.
Ah.
Tapos mga iba kong subjects, puro neuro.
Ah.
Actually, naisip ko na i-curate yung organization and administration. Sa new curricula to ha, kuya, na 4 years na PT. Na learning experience design. Ganun siya. Na hindi kami kailangan, na asynchronous siya. Hindi namin kailangan mag-synchronous.
Oh.
So, meron, yeah.
Pumayag.
So, hindi namin kailangan mag-meet. Hindi namin kailangan mag-meet.
Oo naman. School. Wow.
Oo naman. Basta tayo.
So, ano to? Ano na? So, ano na to? Nag-work na? I mean...
Hindi po. Mag-start pa kami sa next month na, my God. So, yun. So, all of my materials will be put up. Mala playlist design siya. So, tapos, doon sa playlist na yun, syempre, nakalagay doon yung course outline kung kailan kami mag-exam. Doon lang kami magkikita.
Sa school? Or
sa
live? Online din?
Or live, synchronous.
So, ano ang, at the end of the course, at the end of the SEM, ano ang output nila?
That is, let's say, for instance, who have their own, how to put up a clinic and all, or how to administer a college, or, Yeah.
Ganda.
Something that I'm still curating. Ang kinukurate ko pala ngayon is more on the topic delivery. Na gusto kong ilagay siya na mala playlist na okay, ikaw bahala kung anong gusto mong unahin na topic for my subject. At least, yung oras na nakapunta sa akin is for them to, chill lang. No, hindi na ako makiki-burden sa iba pang subject.
Tapos if they have questions, tsaka na lang sila mag-relieve ng comments, discussion board.
Yeah. And also nakalagay dun sa sa syllabus na kung ano yung availability time ko for that subject. Kung kailan ako pwede tanungin for any questions. Yeah. Napaka-importante nun, no? Na dapat alam nila kung kailan kanila pwedeng disturbohin, pwede kanila tanungin, para at least nabibigyan mo sila din ng voice as to their concerns or problems with regards to your online delivery.
Right.
So, yeah.
Yeah, yun nga. Parang yung sa amin sa online na transitional DPT, it's asynchronous. So, if marami nang natatapos ako hindi nahuli pa nga ako Pero marami nang nakatapos ng course. Tapos they leave comments sa discussion board for everyone to see. And the facilitator, the moderator would answer the questions para lang hindi na maulit yung mga questions. Tapos may follow-up na lang yung ibang mga classmates if they have any questions. So maganda nga yan, like
diba?
May mga subjects na pwede na applicable din naman talaga yung mga...
Diba, kuya? Ibigay na natin yung spotlight or yung maraming synchronous kung kakailanganin o kailangan ng face-to-face, ibigay natin yun sa mga talagang clinical-based subjects. Wag na, para sa akin, ORAD. Hindi ko na ipapaburden pa yung ORAD ko. Diba? Bibigay ko na lang yung sa neuro. Ako din pala yung teacher. No?
Hindi, at least diba? At least na sabi mo tapos na ng estudyante mo yung yung course niya kung asynchronous naman.
Yeah. So, something that our listeners could have an idea then how to go about with that.
Right. So yung instructional design, diba, that was the bulk of your Digiflex. Ito naman, saan mo naman nakuha yung like the passion? Where did you discover the passion in your instructional design? Siyempre, sabi mo, it's important in teaching. Nung nakikinig ako nung webinar mo, sabi ko, sana nalaman ko to before I taught. Kasi ang daming magandang points na it would be really applicable to my case before when I was teaching. Pero where did you get that passion?
Siguro that started nung ako na nung binibigyan ako ng syllabus. So, okay, this is how this subject would be would be delivered. And luckily talaga na pinagkakatiwalaan ako ng direct supervisor ko na yung share ko mismo na to curate whatever it is of my liking.
Mm-hmm.
So, hindi ko kailangan na mag-copy-paste ng syllabus.
Right.
Doon ako nagsimula.
Mm-hmm.
Sabi ko, wow, nag-enjoy ako. Parang, kapag ako gumagawa ng syllabus, I see to it that kung ako yung bata doon, kung ako yung estudyante doon, paano ako magsusurvive?
Mm-hmm.
So, nung nilagay ko yung bawat topics, okay, itong gagawin niya, ito yung gagawin ko bilang estudyante. So, nilalagay ko sa shoes ko yung pananaw nila.
Mm-hmm.
O-overwhelm ba ako? Although na-overwhelm naman sila. Kasi hindi nga sila nasanay sa ganung sistema na active learning, no?
Mm-hmm.
Pero, that's a good start for them. Because in life, hindi ka naman maghihintay ng mangga na santol ba yun? Na mahuhulog na lang sa'yo. No? So, kailangan mo pa rin magtrabaho, kailangan mo ikaw kumilos. So, ganun ko sila. Ganun yung flow ko ng syllabus, ng instructional design. And then, such time na binigyan ko ng idea yung supervisor ko, hi Sir Clint from Manila Adventist College, to curate clinical integration, no?
Mm-hmm.
Clinical integration subjects na in unison with one another. Doon ko na-realize na importante talaga yung alignment kasi naisip ko na ang daming mga subjects na pwede mong aralin kahit nasa bahay ka lang.
Mm-hmm.
Noon ko pa yun na-foresee. Tapos, ang dami ng subjects natin na kahit isang subject lang yun. Di ba?
Oo.
Yung TheraX mo at saka PT seminar mo, pwede mo ilagay lang sa lahat yun sa Clean Ed. Tapos gawin mong 2 days na 6 hours.
Mm-hmm.
Diba? Pwede naman yun. I mean, it's really a matter on how you curate your instructional design.
Mm-hmm.
Nung nag-helm na ako nung pagkakaroon ng unison ng clinical integration subjects, doon ko na-realize na doon na yung reflection ko na ang daming mga subjects na redundant.
Mm-hmm.
Na pwede mo namang ilagay sa isang subject lang.
Mm-hmm.
Then, hence the reason why, sabi ko, wala na akong magagawa sa curricula.
Mm-hmm.
Ako nag-reach out on how to go about with the alignment.
Mm-hmm.
Doon ko na na-realize yung importance ng instructional design. And iba rin ang pagkakaturo din sa amin sa Masters. Regards to my professor sa education, no? Educational sa Masters, no? Ma'am Gigi Mojica. Ma'am, you're the best. Si Ma'am Gigi talaga sabi ko na, wow. Okay. Doon siya yung nagpa-realize sa akin na kagandahan ng alignment alignment is very important with regards to how you deliver your teaching and learning strategies.
Mm-hmm.
So doon ko din na-realize na, nagtuturo ako. Dapat alam ko kung paano gumawa ng instructional design. Napaka-importante talaga nun.
Tama. Pero you mentioned that like there's already courses or subjects na pwede pag-isahin. Doon sa new curricula ba na-address na yun or it's still the same na magkakahiwal pa rin mo sila or na-address na?
Na-address na po.
Na-address na.
Na-address na. At saka nakadepende pa rin yun sa higher education institutions kung gusto mo bang magkaroon ng separate subject.
Mm-hmm.
Saan nakagawian mo.
Mm-hmm.
Kasi may mga alam ako mga schools, no?
Mm-hmm.
Not saying from my schools, no?
Mm-hmm.
That I'm teaching. From other schools na nagdagdag sila ng subject na, for example, wala naman din sa wala doon sa course offerings for the new curricula ang TheraX.
Okay.
Pero meron silang TheraX.
Oh, okay.
Nagdagdag sila ng subject na TheraX.
Mm-hmm.
Parang intro to exercises. Yun. Na-separate na wala doon sa new curricula. So, dinagdag pa nila yun.
Mm-hmm.
So, it's a good thing that you may want to consider. And another, yung iba naman kasing schools, nilagay nila siya sa mga specialized subjects. For
Subjects.
example, cardio PT. Doon ka magtuturo ng exercises muna and then doon. So, it's really, a matter on how you go about with your instructional design. Again, pabalik-balik ka pa rin kung paano mo ginawa yung instructional design. Paiikot-ikutin ka lagi sa instructional design. Pag sinabi ng teacher na, ano ba yan? Bakit ang dami bumabagsak sa mga estudyante ko? Tignan mo po kung paano po yung outcomes niyo. Ng topics. Baka hindi naman nagtutugma. O baka naman po nagpapa-on the spot ka na assessment.
Hindi man sila prepared.
Mahirap din po yung maglalagay na dun sa grading na others.
Others?
Oo, may others.
Ano
may nakikita akong ganung grading, May nakalagay doon, class
sa
participation.
rubrics?
Di po sa grading system.
Sa grading system, may others?
May others. Sabi ko, nakalagay doon yung mga assignment. Others, nakalagay. Naka-open and close parenthesis. Assignment, reflection, and all. Ay, wag po ganun. Dapat po, naka-indicate po kung ano yon. Kasi, questionable ang others.
Like for example, walang breakdown quizzes, exams, tapos bilang others.
Nakakuha mo, kuya. Paano ang breakdown ng others? Ilang percent yung nasa open and close parenthesis? Mahirap po yun. Kaya siguro maraming buwabagsak dahil, it's really a matter on how you curate your instructional design. You'll never go wrong if you're familiar with yung pasikot-sikot ng instructional design. Kasi, the success of your students would reflect on how well did you curate your instructional design from vision, mission, all the way to your subjects assessments.
Talagang original content creator sa yung mga teachers.
Yeah.
Sila dapat ang influencers.
Influencer, wow. Pero mababa ang sahod.
Kaya nga dapat mabigyan ng
Kasi buti pa social media influencers, no?
Diba? May sponsor sila, mga teachers.
Wala po kami.
Mga teachers and instructors.
iPad. Joke lang. Sige po.
Baka naman pwede. Pa-sponsor. So, na-mention mo kanina yung the thrust na curriculum ngayon ay more on like, di ba, specializations, ang pagtuturo. And I think we also tackled tawag dito. So, paano yung pagpasok ng estudyante, first year, meron na silang specialization or may intro muna? Or
may intro muna, kuya.
May intro muna?
Kuya, lahat ng mga first year subjects ay mga anatomy, introduction.
So yung mga third year natin na majors before, diba? First year na nila.
Ang first year na yun. Grabe. At ang second year, panay specialization. Specialized subjects na. Second year and third year.
Paano ang internship? Doon pa rin? Doon pa rin sa dulo?
Ang internship, fourth year. But, I know some schools who are having their internship even at first year level pa lang.
Ay, talaga?
Pwede yun.
Kasi pag ganun dito sa US, ang mga DPTs parang may first year may internship na sila
It really depends on how, for example, ang CBR, pwede mo na ilabas agad sila. Kasi, syempre, dapat nakapag-basic to, na sila, intro to PT, marunong sila mag-vital signs and everything, no? Doon mo ilagay yun. So, sa second year, pwede na kayo lumabas. O, kayo, CBR. Pwede na yun. Pwede na yun. So, ibig sabihin, nakapag-internship na agad sila at an early,
Oo nga.
aga pa lang.
Di
bawas yung bawas yung fourth year nila.
Totoo.
Exactly.
Mulat na sila pagdating.
Totoo yun, kuya. At least, gusto ko yung sinabi mo, kuya, mulat. No? Totoo yan. Kasi, totoo yun, no? Example, yung senior high school nga po, nung graduate sila, kagaling na nila mag-OJT. Okay. So, nag-OJT na po sila nung senior high school. Oo.
OJT saan?
OJT kung saan nila gusto na na mag-training. Opo,
Mm.
pwede na po sila doon. Tapos pagdating nila ng first year, pababalikin mo sila sa classroom, hindi
Mhm.
matatama rin ulit yung estudyante. Eh, active learners
Mm.
nga po sila. So, yun yung
Mm.
sinasabi natin na dapat, no? Tama yung sinabi mo kanina, kuya, na dapat talaga na ma-appreciate na agad ng mga estudyante kung ano yung pagiging PT first year pa lang. Parang, di ba mainggan yung agad sila what PT is all about, lalo na sa mga undecided.
Mhm. Dapat, I mean, siguro baka kailangan din ng mag-open up ng school ng mga ano, I mean, institutions ng pre-PTs
Yeah.
na kasi dito may ganun mga pre-PT students. Tapos may mga ganun ng estudyante na ano lang, nagsha-shadow sa akin. Hindi pa siya PT noon Pre-PT pa lang
Ah,
siya, mag-a-apply pa lang siya
ginagawa
to
na
PT
yan, kuya,
school.
sa senior high school.
Ah, yun ang maganda.
Yeah.
Ano
Hmm.
lang sila doon, nag-shadow lang siya sa akin for how many weeks? At
Mm.
katulong ko lang, like, tagadala lang ng ganitong gamit, tapos pinapanood lang niya ako,
Oh,
kinakausap
that's
lang niya
nice.
yung mga pasyente, papakilala ko
That's
siya sa
nice.
pasyente. I mean,
That's
doon pa
nice.
lang, makikita na nila kung anong ginagawa ng PT at kung gusto ba
That's nice.
nila.
That's
Kasi,
really nice, kuya. That's really
oo,
nice. Kaso nga lang, kuya, ang dito sa Philippines, dalawa lang nag-o-offer na health allied strand.
talaga?
Nga sa senior high school, we have
Oo.
UST and Lasal HSI sa Dasma Cavite.
Mm.
So sila lang talaga makaka-appreciate ng mga health allied courses, allied health
Tama.
courses. E paano yung mga nasa STEM?
Mm.
Eh doon sa subjects nila, based from
Halo
what
eh.
I've heard from the STEM from those who graduated from STEM strand, tinuruan sila ng molecular biology, di ba? Molecular biology, ano pa ba? Botany, mga ganun. Eh,
Mm.
tapos nag-PT sila. Tapos tinanong ko, may idea ba kayo sa anatomy physiology? Ay, wala po. Yung iba meron po. Eh, one day lang po namin diniskusyon. Ay, Diyos ko, paano tayo?
Yeah. Mm-mm.
Ayun yung problema din na dapat, sana po sa senior high school din, magkaroon din ng health allied strand for
Mhm.
all. For
Mm.
all. For those who would want to take um, pharmacy,
Mhm.
medtech, or clinical medical laboratories, yeah, for PT, OT, and all, at least
Mm.
doon, nakaka-curate na yung pang medical courses,
Mhm.
ma-engage mo agad sila na ito pang medical courses talaga to. And not necessarily for those who would, bahala ka mag-isip kung anong gusto mo. I-inoferan kita ng pang-calculus, pang-engineering, ganun. O, ikaw nang bahala, mag-isip ko anong sa mo gusto.
Hindi mo ma-appreciate yung inclination mo sa
Yes.
human body and stuff
Yes.
or sa,
Yes.
health allied professions kung hindi
Exactly.
ganun talaga ang direksyon ng track mo eh.
Tama. Yeah.
Mm.
Oh, ang dami nating realization dito, no?
True. Okay. So, medyo mapunta tayo sa end ng ating conversation. So, what are probably other topics that you want to share with our listeners na you think
Naman
are
top.
important?
I think, no, more on tayo, no? I think dun sa most essential learning competencies.
Mm-hmm.
Kasi, ang Department of Education is actually gunning for most essential learning competencies
Mm-hmm.
sa high school or for preschool all the way to high school.
Mm-hmm.
How about for professional courses? Ano ba ang most essential learning competencies na pwede nating i-offer? Or baka naman sobrang ang dami ng lahat ba ng subjects essential? Baka naman